I'm Carrie Henry, and I'm a nurse midwife and an assistant professor of nursing at the University of Alabama. I'm really looking forward to seeing you at the International Perinatal Bereavement Conference in just a few weeks in New Orleans. I'm going to be presenting a session called Fourth Trimester Care After Perinatal Loss, and I want to give you a little idea of what to expect at that session. I think we all know that a pregnancy is typically considered to last for 3 trimesters. The fourth trimester then is that first 12 weeks after the baby's birth, and that time is always a time of transition and vulnerability for those moms and babies and families. In this session, we'll talk specifically about both the mental health and the physical health considerations for those mothers who've had a perinatal loss. Now, after any kind of pregnancy loss or perinatal loss, of course, those of us attending the International Perinatal Bereavement Conference are well aware that those moms are at an increased risk of perinatal mood disorders, and they need a lot of support. Even if they don't have depression or another mental health diagnosis, they're still in need of significant grief support. But did you know that women who've had a perinatal loss are often also at an increased risk of physical complications of pregnancy? It turns out the risk factors for stillbirth and preterm birth, and of course we know that preterm birth drives a lot of our neonatal deaths. Those risk factors are basically the same as the risk factors for severe maternal morbidity and mortality. There's a significant overlap there. In addition, these moms are less likely to come back to see their provider for their postpartum visit, so they might not see a member of the healthcare team once they leave the hospital. Or if they do see a member of the healthcare team, it might be a counselor or support group leader or other support system that they're seeking out to help deal with the mental health effects of that loss. And so every member of the healthcare team needs to be really tuned in to both the mental health and also the physical health risks for women who've had perinatal losses. So we'll be talking about that in our session, and I really hope to see you there. Thank you.